In recent years, the consumption of energy drinks has surged, especially among adolescents and young adults. These beverages, often high in caffeine and other stimulants, are marketed for their purported ability to enhance energy levels, improve alertness, and boost physical and mental performance. However, the growing popularity of energy drinks masks a darker reality. These products pose significant health risks. This video explores the adverse health effects of energy drink consumption, particularly among adolescents, and discusses the regulatory and public health measures needed to mitigate these risks. The health risks of energy drinks. Increased risk when mixed with alcohol. Combining energy drinks with alcohol is a dangerous trend among adolescents and young adults. The stimulant effects of caffeine can mask the depressant effects of alcohol, leading individuals to underestimate their level of intoxication. Research indicates that this combination is associated with elevated rates of binge drinking, impaired driving, risky sexual behavior, and a higher risk of developing alcohol dependence. According to Alford et al., in 2015, the false sense of sobriety induced by caffeine increases the likelihood of engaging in hazardous activities while intoxicated. Excessive consumption of energy drinks can lead to caffeine intoxication, a condition characterized by symptoms such as tachycardia, rapid heartbeat, vomiting, cardiac arrhythmias, irregular heartbeats, seizures, and in extreme cases, death. A study by Wolk et al. In 2012 highlights the potential for acute toxicity with high caffeine intake. For children and adolescents, the long-term effects include disrupted sleep patterns, increased blood pressure, exacerbated psychiatric conditions, and potential addiction. The consumption of energy drinks among youth is particularly concerning due to their vulnerability to caffeine's effects. Adolescents who consume these beverages are at risk of caffeine toxicity, which can lead to elevated blood pressure and sleep disturbances. Additionally, there are significant physiological and behavioral effects, including increased risk-taking behaviors and mental health issues. The stimulant properties of caffeine can exacerbate anxiety, depression, and other psychiatric disorders in young people. Energy drink consumption has been linked to cardiovascular issues, such as increased heart rate and blood pressure. According to Breda et al., 2014, the stimulant properties of caffeine can also lead to addiction, further compounding health complications. Adolescents consuming high quantities of energy drinks report symptoms like insomnia, anxiety, jitteriness, and nervousness. Severe reactions include seizures and acute mania. These beverages also exacerbate stress and depressive moods, increasing the likelihood of suicidal ideation and attempts. The U.S. Food and Drug Administration, FDA, has taken steps to address the safety of caffeine in the food supply, particularly concerning energy drinks. Despite these efforts, there is still a need for more stringent regulatory and legislative measures. Proposed measures include better labeling, restrictions on marketing to youth, and limiting the amount of caffeine in these beverages. High consumption of energy drinks among adolescents poses significant health risks. The literature highlights adverse reactions ranging from mild sleep disturbances to severe cardiovascular events and seizures. Additionally, energy drinks are associated with increased substance use, including tobacco, alcohol, and illicit drugs. In an expanded literature-based evaluation, it is clear that energy drinks contain high levels of caffeine, leading to acute caffeine intoxication. Symptoms include tachycardia, vomiting, cardiac arrhythmias, seizures, and even death, as noted by Wolk and colleagues in 2012. Chronic high-dose caffeine intake disrupts sleep patterns, exacerbates psychiatric conditions, and can lead to physiological dependence and addiction, according to DeSanctis et al. In 2017. Furthermore, overconsumption of energy drinks is linked to cardiovascular issues such as elevated blood pressure, increased heart rate, arrhythmias, and myocardial ischemia. These complications can be severe and sometimes fatal, as Croissant and Croissant highlighted in 2014. Adolescents with pre-existing heart conditions are particularly at risk. There is a strong association between energy drink consumption and increased use of tobacco, alcohol, and illicit drugs. Adolescents who consume energy drinks are more likely to engage in risk-taking behaviors and substance abuse, according to Ruiz and Scher in 2019. The stimulant effects of caffeine may lower inhibitions and lead to poor decision-making. Frequent energy drink consumption is associated with late bedtimes and poor sleep quality. Adolescents consuming these drinks report higher incidences of sleep problems, contributing to fatigue and reduced academic performance, as noted by Koivusilta and colleagues in 2016. Poor sleep can have cascading effects on mental and physical health. High consumption of energy drinks is linked to behavioral issues such as aggression, hyperactivity, and emotional instability. Adolescents report feeling more anxious and stressed, with some experiencing acute behavioral disturbances, as detailed by Seifert and others in 2011. These effects can disrupt social relationships and academic performance. The consumption of energy drinks among adolescents poses multiple health risks, including cardiovascular complications, neurological and psychiatric effects, increased substance use, and sleep disturbances. These risks are compounded by aggressive marketing to young people and the lack of regulatory oversight on their sale and consumption. To protect adolescents from the potential harms of energy drinks, it is crucial to implement stricter regulatory measures. This includes better labeling, restrictions on marketing to youth, and limiting the caffeine content in these beverages. Additionally, increased public awareness campaigns are needed to educate parents, teachers, and young people about the dangers of energy drink consumption. Ultimately, safeguarding the health of adolescents requires a concerted effort from policymakers, health professionals, educators, and the community at large. By working together, we can mitigate the risks associated with energy drinks and promote healthier lifestyle choices among young people. Thanks for watching Medical Toxicology. Take care.